everyone, I am Beatrice. At the end of the lecture, I'll be reviewing some commonly asked questions for your nursing school exam and especially for the NCLEX examination. So stick around, let's dive in. Now, the second management for asthma is medication. In fact, this is very, very important. Now, for the medication, they will be using two different groups of medication. If you remember the pathophysiology of asthma, there is going to be inflammatory response. There will be inflammation of those lungs, the airways. Now, there's also going to be bronchoconstriction. So they'll be using bronchodilators to fix the bronchoconstriction. They'll be using anti-inflammatory to fix those swelling, those inflammation. There are three classes of bronchodilators you want to know. The first is beta agonists. Now, this beta agonist can be short-acting beta agonist and long-acting beta agonist. The difference between the two is that the short-acting beta agonist is for acute attack. That is a reliever drug. You use it when the attack is happening. It's not supposed to be used for long-term purpose or for maintenance purpose. An example of short-acting beta agonist is Albuterol. Now, this medication, like I mentioned, is a short-acting medication, so it should, just as it goes short-acting, it acts fast, so it's for relief purpose when they are having the attack. The long-acting beta agonist, an example is Salmeterol. So this one, as it goes, is long-acting, it's supposed to be a maintenance therapy. So the time they are having an attack, it shouldn't be the medication they are using. The medication is supposed to be used for maintenance purpose. You need to teach the patient about beta agonists. This medication, whether short-acting or long-acting, you want to teach them, because when they are taking the medication and they begin to see some signs or side effects, they shouldn't get anxious or worried about why they are feeling that way. So it's important you teach them at every stage. You teach them about, for beta agonists, there may be increased heart rate, tachycardia. They may feel nervousness, even palpitation, see their heart is pounding fast, and as if you want to jump out. So teach them this thing so they are aware that when they take this medication, the short-acting or the long-acting beta agonist, they could feel those symptoms. Beta agonists, another thing you want to notice that they are inhaled. The next one is anticholinergics. So for patients that are not able to tolerate beta agonists, they may also place them on anticholinergics. This one are also inhaled. Now, they, just like beta agonists, they also have the short-acting and the long-acting. Is this for the same purpose? The short-acting for reliever when there's an acute attack, and long-acting for maintenance. Example of the short-acting include medication like Ipratropium. And the long-acting, an example is tiotropium. Now, you're also going to teach them the side effects of anticholinergics so that they are aware. And this side effect has to do with dry mouth. Very unique. You need to know this. Dry mouth comes with anticholinergic use. And because of that, you need to encourage them to keep themselves hydrated. And also, they can chew sugarless candy to keep the mouth wet. The next thing is the third group of bronchodilators that you may also be telling them about is the Theophylline. For Theophylline is only available as oral. It's an oral medication. Now, when they are taking Theophylline, you want to also teach them to take it with caution, because Theophylline has a narrow therapeutic range, so they can easily go into toxicity. The normal range for Theophylline is between 10 to 20 micrograms per ml. So they should take the medication with caution. So you need to teach them about any signs of Theophylline toxicity, things like nausea, vomiting, nervousness, restlessness, when they are feeling anxious, and even palpitation, seizures. So they should watch out for this. When they feel any of this, it could be a sign of Theophylline toxicity. They need to contact their healthcare provider immediately. Now we move to anti-inflammatory, which is the second group of medication. Now, for the anti-inflammatory, we have the corticosteroids and the leukotriene modifiers. Now, for the corticosteroid, the example of this medication include medication like fluticasone. We have beclomethasone, and there is also budesonide. These ones for corticosteroid, they are available as IV. They are also available as oral. And then these ones I've mentioned, like fluticasone, beclomethasone, and budesonide, they are available as inhaled. So you're also going to be teaching them things around corticosteroid use. Now, if they are placed on both medication, the usual pattern to take it is the beta agonist first before the corticosteroid. You're also going to teach them when they are taking it, they should wait 5 minutes first before they take their corticosteroids. And after taking their corticosteroid, they should rinse their mouth and spill it out. You're also going to teach them that they have more than one dose prescription for their beta agonist. When they take the first dose, they should wait 1 minute before they repeat the process. Corticosteroids, they also come with those side effects. So you want to teach them some of these side effects of corticosteroids, which include hyperglycemia, high glucose, so they should monitor their glucose closely, increased risk for infection, even including oral trash. So that's why they should rinse their mouth and spit it out immediately after using corticosteroid inhalers. And other side effects include osteoporosis, and also they can also have cataracts. Those are some side effects that can come with corticosteroids. Now we have the Leukotriene modifiers. So for the Leukotriene modifiers, if you remember when I was talking about the pathophysiology of asthma, I mentioned the role of that Leukotriene. It's going to cause bronchoconstriction. So if they give Leukotriene modifiers, it's going to modify or stop the action of those Leukotriene, leading to muscle and smooth muscles of the lungs and the airways relaxation and decreasing mucus production, decreasing bronchoconstriction. So an example of medication in this group is montelukast. As I promised, we are going to review some questions, some common questions that you could encounter in your nursing school exam and even for your NCLEX. So the first question is, what is a common side effect of albuterol? Now, you should know that albuterol is a bronchodilator, is a short-acting beta agonist. So just like every bronchodilator, it can lead to increased heart rate, palpitation, nervousness, restlessness, tremor. You should know this for your exam purpose. Another question. Which medication is used for long-term asthma control, not quick relief? Now, the medication that are used for long-term asthma control include medication like long-acting beta agonists like Salmeterol. Corticosteroids are for long purpose. And even long-acting anticholinergics are for also long-term management of asthma. What is the correct order for using a bronchodilator and corticosteroid inhaler? Now, the correct order is your bronchodilator first, you wait 5 minutes, and then your corticosteroid. So that is the correct order. What does a yellow zone reading on a peak flow meter indicate? Now, for the peak flow meter, the goal is for them to remain at the green zone. That is above 80%, between 80 to 100% is the green zone. That's the best zone they can be. At that zone, they will not be having all the attacks. They will be breathing well. When you auscultate their lungs, there will be no wheezing. So they will just be on their long-term medication maintenance therapy. Now, for yellow zone, which we don't want the patient to be, it means it's between like 50 to 75%. If they are at that zone, it's a problem. It shows that their asthma is not well controlled, and that means they will need support. Apart from the maintenance therapy, they will need their short-acting, those their reliever medication. That means they will be having wheezing, they will be having cough, that chest tightness may be there. So that is the yellow zone. The red zone is a no-go area. If they are in the red zone, they will find it difficult to breathe, even to speak. Then at that point, they will need medical attention urgently. Next question. What are early signs of theophylline toxicity? The early signs include things like nausea, vomiting, restlessness, tremor, even seizures. What is the purpose of a spacer with an inhaler? Now, the purpose of using a spacer with an inhaler is to get as much medication into the lungs and to reduce risk of infection like oral thrush. What should you teach a patient after using an inhaled corticosteroid? Now, for this one, you should teach them to rinse their mouth with water and spit it out to reduce the risk of development of infection like oral thrush. So we've come to the end of today's lecture. If you find this video helpful, please like, share, and subscribe for more content. See you next time. Thanks for watching.